Welcome back, everybody. Hello.
Hi guys, how's it going?
So, Lydia and Finn, as usual. I feel like I never say that.
No, you are now. It's now a routine. You've done it twice. That's good.
Lydia
it's my
and
line,
Finn, as usual. And today we are joined by a very special guest, and actually, hopefully, soon to be our resident homeopath,
if we can reel her in.
Edgen. Welcome. Nice to have you.
Thank you for having me.
Coming all the way from France, no less.
South of France, where it's all sunny and all. Well, it's supposed to be sunny and warm, but it's windy and cloudy today. So
we're feeling a bit better now.
Yeah.
Yeah.
Yeah, we like a 10-month summer as opposed to like a week and a half long summer. You know, it's pretty good. You probably have it fairly nailed.
Look at the sweat on me. Doing that's a cloudy day. Give me.
You look glowy.
You have a good glow.
I think.
Oh, no, we're calling it glow. Okay, fair enough.
Yeah. Glow.
That's why the glow probably became popular, because it was like, but I sweat all the time and I talk about these matte things. Let's just go for glow. Yeah, so much easier to achieve a glow.
I do get messages on social media. It's like, where'd you get that natural highlighter? I'm like, sweat and 38 degrees.
A sheen of perspiration.
Yeah.
That's good.
Yeah.
Right, T-zone. Good.
So
anyway,
homeopathy. We're really excited to have you on. I have grown up with homeopathy my whole life. When we lived in Nepal when I was a little girl, we were 7,500 feet up a mountain with no running water or electricity or doctors, and my mum just had a homeopathy do-it-yourself book, like, here's an ailment. Brilliant. Do this thing. Which was pretty exciting. And so I've been using it my whole life, and I've used it with my little boy. But what I did find was that when I had my little boy and I dutifully got various different, like, mother and child kit from Helios or whatever, then you just have a booklet, and then there's just like 1,000 different things in it. And you're like, I don't know if this phlegm is greeny yellow or yellowy green. I don't know.
If it comes in the night and goes in the day, if it's better for hot or cold, or if it's like, there's a lot of technical. When they're
really little and you can't ask them, and you're like, is this better when you're is this a little bit tickly or a little bit, and they're just like, so it was really nice when I was talking to you, because it seemed like what you were saying was you've actually kind of developed your own little system that makes things just demystified and much more simple for parents.
Yes, I feedback over the last few years is exactly what you've just said there. It's like parents want to use homeopathy. They've either worked with a homeopath and they've had great reactions with the remedies, but doing it themselves, everything sounds the same. And in my practice, I treat a lot of coughs. I think all homeopaths, you kind of see a pattern. So I treat a lot of coughs. And I don't know, Lydia, if you've seen cough remedies, but they all look the exact same, written down in one of these books. So so that was quite a frustration for my patients. And the reason why I'm so passionate about treating what we call acute small seasonal ailments is for the bigger picture for the kids. And I'll talk about that later if you want, about antibiotics, from what I observed in practice. So I needed to come up with something a very easy system to patients who either had never used homeopathy or they really wanted to. If they've never used homeopathy, they actually didn't care what it was. They just wanted something that worked. Or if they want to use homeopathy, they didn't have time to do the 4 years training. They needed something simple. So I developed this methodology that breaks an acute down into 3 simple stages. So it's more of a strategic use of homeopathic remedies. Now, its application can be if you're into classical homeopathy, which is kind of the purest form of homeopathy. When you're applying it, it fits into the philosophy, but how you're choosing the remedy is different, because as you know, Lydia, when you're choosing the remedy, it's all about the symptoms. Whereas when I use my system, it's all about the stages of the acute.
Okay.
So it's very simplified.
So for people who are listening and going, stages of the acute, what does that mean? Can you go into that more?
So you've all been there. So if I always tell people when I'm describing this method is remember your last cough or cold or sore throat. So the 3 stages. So there's the inflammatory stage, there's the mucus stage, because I'm obsessed with talking about mucus and its color and texture. And then there's the recovery stage. So the inflammatory stage is where you get the heat, you get the pain, you get the fever, you get basically what's happening in the body is flooding white blood cells to the site of infection, opening up circulation to get as much blood flow there. And that's what's causing the pain. What then naturally occurs is as your body's fighting an infection, mucus develops to protect the body, to try and draw out dead white blood cells from after they've done their job. Now, so that's the mucus stage. Now, the problem with treatments, or what can happen if you're leaving, most mucus stages should be clear fluid mucus. what can happen if it doesn't get away from the site of infection quick enough? It becomes thicker, it can become greeny. Unfortunately, sometimes it can go yellow. And so we want to treat that to prevent that happening. So when I'm having remedies for each symptom stage, it's to prevent that happening, and therefore the secondary bacterial infection. So when you're following the ABC method, you've done the stage 1. Sometimes you don't even need to treat stage 2, because when you kind of reduce the inflammation quite quickly, the mucus doesn't stick in the site of infection. It drains quickly. So like a very runny nose is a great sign, remedy reaction. So then that goes into the recovery stage, because after an immune response, our body uses up zinc, vitamin C, vitamin D, iron. We need to kind of build our body back up so you don't get the relapse. I think all parents have seen that in their kids. It goes from one cold to another, and trying to avoid that. So they're the 3 symptom stages of an acute.
Okay, that makes so much sense. And it is really simple then, because otherwise you're kind of going in, like I think it's just the same as we were talking about with climate change the other day. When something's too complicated, you get this paralysis where you just do nothing. You just kind of look at the book and you're like, I don't know. And there is a panic, because you think, if I give the wrong one, am I doing more damage than if I do nothing? So then you end up doing none of it, because you're like, And the other thing I found was, you couldn't get hold of a homeopath. You were like, but the child's sick now, and then you're going to have an appointment in 1 week, and you're like, unhelpful.
Yeah. I treat a lot of acutes. I find it kind of can change a whole case in a kid's health when you treat the acute successfully. So I like, text me anytime. Like sometimes if I'm awake at 3 a.m, I will reply. I think the earliest it's only once been 3 a.m. I've had 6 a.m. And it's because as soon as when I apply it, I call my methodology the ABC method, because one of the remedies is ABC. And the sooner you treat the stage 1 inflammatory, it changes everything. So like you said, when you see your child is ill, usually they've got the cough or they've got the snotty nose. That's already gone into stage 2. You need to get the stage 1 quite quickly, and then it changes everything. So I have this thing I call the warning symptom. And my warning symptom, like you couldn't go to a doctor with your warning symptom. They'd just look at you like you're mad. So my warning system is hot eyes. When I have heat behind my, obviously I don't, because I'm a homeopath and I'm so healthy. But when I have hot eyes, I know, okay, my body is fighting something off. I take my remedies and it stops.
Okay.
So you have to know that warning. I think the glassy eyes in kids, that's a warning.
Yeah.
You know, in 3 days it's going to hit.
Yeah.
And so as you're getting to know kids and different kids, obviously within their own, kind of, each kid has their own response time and their own type of response and that sort of stuff. Does it mean that the way you apply the ABC method changes, or is it like bulletproof, rock solid, this is going to be the way for every single?
That's a great question. So I've been doing this methodology for 10 years. And so I've kind of gotten it down. I'm trying to do a flow chart, but I overcomplicate everything. So it's a bit like, so you can actually do a flow chart for every child. Now there is a small group of children where it doesn't apply, but you see that within 6 hours, like you see it straight away. And usually there's always a reason when the ABC method doesn't apply to a child. And in the cases that I've seen is because they have a complete imbalanced gut or parasites or something like that. So usually it's the same methodology, even for adults actually. That started off by treating adults and then it shifted into kids. So it's always the same methodology, because when you apply it, I'm a big fan when I talk about homeopathy and educate my patients is about learning remedy reaction. That's almost as important as the remedy. I need to do an Instagram post on that actually, because when you understand what the remedy is doing, you know if it's working or not. Because I think there's that myth, like you get the one in the books and you're like, it should stop now. Like, why is this cough still? So basically, to highlight why the reaction, you need to understand reactions to empower and to feel confident in your prescriptions. Is, say if you have a child who has a cough and they're trying to, they sound like they're hocking up a lung because the mucus is stuck there. It mightn't even be a cough from the lung. It might just be a postnasal drip. You give a homeopathic remedy, the stage 2 remedy, and what happens is they cough, but the mucus comes up because the mucus is becoming thinner. That's going in the right direction. You keep with the same remedy, they're starting to cough up. They don't cough at night because previously they were coughing at night. They then only cough in the morning, and within 3 days that cough is gone. So you know the reaction that the remedy is working. But sometimes you can get that one remedy is like, oh my God, it's all gone. This is magic. Where's it gone to? But generally it's all the process, especially if you're already gone into the stage 2.
So Miranda Castro, the classical homeopathy thing, I have her book. It's the thing I would have referred to. And it's the thing that's both brought me to homeopathy and kind of been a bit aversive, because so for me, I run a shop, I'm dealing with, you know, customers every single day, and it is a little bit like you, that needs to be managed quickly. You know, the stuff that's coming in and out, we only have, I mean, a maximum of 15 minutes with the customer to understand exactly what's going on, give them the right thing.
Yeah.
Because homeopathy is so symptom picture ascribed, it kind of like, it inhibits me for using in terms of using that. Like, how did you end up, like, how come this method already doesn't exist? Like, when so many people are homeopathizing, I
don't even know.
I don't know. Anyway, they're doing homeopathy, practicing homeopathy, let's say, for proper English sake. And how is it that so many other people are still using that classical, not very intangible, but very intricate method, and you're the person who's cleared this up? Did you get a message from gift from God? What's going on?
A channel. I don't know. Maybe I'm impatient. Or maybe I'm just a really bad homeopath. I don't know. It could just where I live, people, as I was saying to you, I came to the obsession with treating acutes because antibiotics are having such an impact on kids' health. And where I live, like, you're having kids at 4 or 5 courses of antibiotics in one viral season. That's in a like 6-month period. And I started to see the pattern in kids. I'm like, we need to find an alternative to this, because that can't keep going on.
And what pattern were you seeing? Just so people who aren't necessarily as averse to antibiotics as we might be in this room, just so people who might be less well versed.
So actually it was like a chicken or an egg. So the ABC method came as a result of treating kids for food intolerances, insomnia, behavioral issues, anxiety disorder, more skin rashes, headaches, like young kids. And I'm like, right, so I have a technique that I can treat for food intolerance, because young kids, they can't do blood tests or prick tests. It's not as clear cut as that. So I got techniques, and I started to treat kids for this. And you started to see kids who have multiple food intolerances across multiple food groups. So it's not okay. So usually you would see food intolerance or food sensitivity or an allergy, it's in one food group. So if you're dairy, it's dairy, cows, sheep, everything like that. But I would start to see them about all food groups. I'm like, this is hopefully it doesn't sound judgy, but it's not right. And luckily where I live, I have colleagues that are GPs, and they then have started to be interested in food intolerances. They saw in kids as well, and we work together. Some kids then do need a blood test later on to confirm for schools, and they start to see the same thing. And we were trying to figure it out. And then I started to look at all the cases, and they had multiple courses of antibiotics. I then started to look at my adult patients, and you can trace all their symptoms back to when they were kids and had multiple courses of antibiotics. So again, I'm not against when I talk about this, I say unnecessary antibiotics, because usually illnesses, about 80% of them are viral, but they're given certain protocols, are given antibiotics as a preventative rather than a treatment.
Yeah. And even when there's so much education, I don't know if they have the same advertising campaigns in France as they do in Ireland, but over here there's like actual ads on the radio now and on TV to say, like, don't give antibiotics if it's a blah, 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 then antibiotics aren't the thing. Like, both like from the Pharmacists Union of Ireland, that sort of stuff. So it's great. So they're trying to reduce the cost, which is fantastic. So there's a real understanding there. Go on, Have
you noticed though, when a lot of that education is similar to that here, but then my patients go to the pediatrician then gives antibiotics. So they get.
I know it hasn't changed much, which is interesting. It hasn't changed,
and the other thing is from what I hear, because I have an amazing GP. He's not like super alternative, but he never prescribes stuff unless it's like, and now I really have to the point where my kid has not had an antibiotic. And anytime I've gone in and he said, maybe this could be one of those times, and I'll say, what happens if we wait, or what happens? He'll go, here, let's leave it 2 or 3 days. And if this has happened, then I'm fine with it. So he's really cool. But he was saying that he gets patients come in and they're just not happy unless they leave with an antibiotic. So the expectation is that they're going in, they want to leave with the pill, because it makes them feel like something's happening.
And that's why when I teach the ABC method, my big part of the education is talking about red flag symptoms. Because when you have a parent who knows, okay, if these happens, this is when we have, not worry, but this is when you kind of have to sit up and like, okay, these are not symptoms that should be happening. So you then have the education to know, it's like, right, I can wait because the red flag symptoms are not happening. So we have a bit more time to let the body heal what it needs to heal. So that's a really good point. But I don't know, in Ireland, have you noticed instead of antibiotics, they're giving cortisone? That's what's happening here. So you're getting kids having multiple courses of cortisone to reduce the inflammation.
Actually, yes, more lately. That's a really good point. I have actually noticed that. Yeah, and I guess that's because I guess they're seeing more less infectious symptoms of infection or communicable infection and more symptoms of kind of chronic disease, inflammatory states like rhinitis and hay fever and these sorts of things. So I suppose it's maybe more that, is it?
No, it's just as an alternative to relieve the pain and discomfort of the kids. So they give, so they give cortisone instead, like for a cough, a sore throat, I don't know how to say it in English. Pharyngitis? You know, pharyngitis. So they would give cortisone instead. And the doctors are then saying to me, going, we're giving these to kids as they're growing, like developmental stages. They shouldn't be having steroids. So it's kind of giving that education, like what is the alternative? Like what I find fantastic is the prevention, it's the vitamin C, it's the propolis, all this talk. But as kids, you know, with kids, their immune system has to stretch its legs. It has to work. So you will always get a few fevers and coughs and colds growing up as the immune system develops. And to give an alternative to that.
And so talk to me about fevers, because my understanding was always that I had always been told by my dad and by my mom when I was really little, like fever is the body's way of dealing with the infection that it's come in. It's good. You sweat it off, like get into bed, you have fresh air, you let the fever do its thing. And it wasn't medicated. And so when I had my son, it was the same. Like he's never been medicated for a fever. And his pattern is he gets a very high fever very quickly. It lasts about a day and a half on and off. And then he's better. And that's the way his illnesses go every time. But that wouldn't be a common thing that lots of people are really frightened of. We've been told to fear fever and febrile convulsions. And it's like straight away give Calpol and Nurofen every 2 hours on a rotation thing. But homeopathy has lots of alternatives to that, right?
Yeah. And that's a stage 1 symptom. So the principal stage 1 remedy would address exactly that, those fever symptoms where you let the body express the fever to do its job, but the child wouldn't be uncomfortable. So that's kind of where the homeopathy is fantastic. That lets the body do what it needs to do. I was raised very similar to you then. Fevers were never a big thing in my families, to the point that I didn't get when my patients were stressed about it, but I'm just like, it's fine. That means your body's working. It's fantastic. But there is that security blanket of Calpol. And unfortunately, when you stop a fever as it's in the middle of it doing its job, it has to come back stronger. So I always say to patients, if you're like, okay, it's fine. You were in the beginning when they're starting to use homeopathy, the ABC method, like fine, but you will notice in 4 to 6 hours, the fever will come back and it will come back stronger and longer. So when they know, they can start to see the pattern, they'll lay off the Calpol. But the fever, so there's the fevers is a part of the red flag symptoms that I discuss, saying if you have these symptoms such as clenched fists, cold feet, doesn't want to be touched, especially for babies. The baby doesn't have that, then you just let the fever work. And that can even be up to a 39-degree fever. When you get to a 40-degree fever, usually when you get a very high fever, like you said for your son, it kind of has a short duration and then it goes. So what I like to work with my patients. If I have a patient who's particularly nervous or in fevers, I'm like, at least give it 4 to 6 hours to work. Always keep an eye for those red flag symptoms. And then if you feel you need to give the Calpol, fine, it won't come back as much. But then again, by the time after 4 to 6, maximum 8 hours, it usually goes. I'm like, oh my God. And they can see the difference in the kids when the fever starts to do what it needs to do.
So I think probably 2 things that might be useful to explain would be the purpose of a fever. And actually, we haven't really discussed like what homeopathy is doing in this, because there's going to be a lot of people listening to this, hopefully, who haven't really been brought to homeopathy yet. Like we're familiars in this room, but maybe how it's working with the fever. First, explain maybe the purpose of the fever and what the body wants to do with that. And then maybe what the actual homeopathy is actually doing in the system, technically.
So fevers, they now know fevers help, resets the body's temperature to fight off pathogens. That's the kind of standard medical explanation for it. It's the hypothalamus, the signals, it raises the core temperature to kill off pathogens. So whether it be viral, bacterial, even fungal in nature. So you can get a fever. So different fevers, actually, you can know for different pathogens. So like chickenpox, you'll get a high fever. A cold, you get a smaller fever. So you can actually tell what you're treating from the fever.
And there's a really interesting thing. There's a really interesting bit of work that was done by, what are they called? Ancestral biologist type people. What are they called? But they were looking at the human. What's that?
Anthropologists?
No. Like when they look ancestral biology, but where they look at like human patterns essentially. But they found that human core temperature has been going steadily up as we've evolved, and that they think that's a response. So pathogens have adapted to the higher temperature in human body. So when you look at, like, I can't remember how they identified it, but human body temperature might have been like 2, even 3 degrees lower on average a couple of thousand years ago. And as the pathogens, the viruses, the bacteria kind of begin to adapt to that, our body pushes higher temperatures and pushes higher temperatures. This is why maybe we're seeing much more variability. And now that everyone's checking their temperatures much more regularly, because we're all thinking COVID, la la la, everyone's going like, but mine is never at 37, it's always at 39 or whatever, do you know?
Yeah.
And it's the relative range that's important, doesn't it?
That makes sense around why viruses mutate. So we obviously have to adapt survival of the fittest to mutate against mutating virus.
Exactly. It's that kind of one step ahead thing.
Well, that's great. I didn't even know.
Isn't it fascinating?
Yeah,
I think that is a useful point that was raised, that it's really useful to have a baseline temperature for yourself and for your kids, and to know, because I know that I tend to have a lower body temperature. Yeah. That I just always have done since I was little. It was always just slightly lower than my brothers and my sons, for example. So I always know, like, if I'm a 37.5, that's quite high for me. I'm going, why? That's if I'm not got my period, or I'm not coming into my period, then that's a slight warning sign for me. Whereas my son, 37.5 would be like nothing for him. It would have to be like 38.5. And then I'd be like, oh, hang on, that's an issue.
Do you have symptoms around there, or are you just checking with the thermometer by any chance?
No, I just know, because if I'm taking his say he's ill and I take his temperature, I'll take mine as well, just to see, like, is the thermometer working? Like, what's going on? Is it really hot in the house? You know, because sometimes it's like, it's a really hot day and you just haven't noticed, and everyone's temperature is like a little bit up, and then you're like, oh, it's only a little bit, it's fine.
And the other part to explain about that as well is that we have different temperatures at different times of the day. So to get your kids' baseline throughout the day, they're usually higher in the morning and lower towards the evening for most kids.
Measuring, if you're measuring here and you have a sinus infection, it's like only 41. Do you mean it's because it's hot, it's throbbing?
It's all coming out there.
Exactly. Change where you're measuring the temperature.
Get a rectal thermometer.
I was just telling you a story about rectal.
They love it in France. They do. Oh yeah. They love suppositories and everything over here.
Interesting.
Which is good, actually.
I mean, it's a brilliant idea, because it's a great absorption moment. Opportunity.
Exactly. For kids, though, in fairness.
It really is harsh. You're like, sorry, just got to check your temperature, but you can just do it. No, bend over.
I know. I was telling Ruben today. I'm so bad. I was telling him today, when we lived in Greece when I was really little, they took me to the doctor. I was like 4, and he did the rectal thermometer thing. And then, as a like, well done, you've been really good, they were like, we'll take you to buy you a toy. And it was kind of one of these old Greek shops that has some stuff in and like something in the back that's really dusty. And the only toy they could find me was a doctor's kit. And then we went home, and my mum like was like, off you go, play in your room. And then there was a lot of silence, and they were like, it's just been too quiet. They came in, and I had the thermometer up the cat's bum, and I was like, Coco's not feeling any well, mommy.
Oh my god.
Oh my god, that's brilliant.
Coco really wasn't feeling well.
Coco was like, Jeannie, and I always let me do it. That's like amazing. Compliant.
I always say to families, make sure if you kind of prefer that method of measuring, make sure you have 2 thermometers and clearly mark them which one's which. Okay.
Okay, enough about the proctology. Moving on.
Okay,
so how is
what's
the
homeopathy doing?
Working on the fever?
Okay, right. So this goes into like how what is homeopathy treating and how homeopathy works. This is actually a controversy around homeopathy. So the philosophy with homeopathy is that our body can actually, a bit like all holistic therapies, our body can actually heal itself. So when it's not healing itself, you're trying to figure, okay, what's going on? Does it need more energy, more vitality, or is there something in your everyday life that is impeding it? So what remedies are doing is actually stimulating that, so your body can heal itself. So for whatever the reason, whether it be a blockage or it just needs more energy. So when you're giving homeopathy, for example, for a fever or an acute, you're enabling its immune system to do its natural function, its work, but you're reducing the severity, the suffering of the symptoms. So that's why what's great about ABC homeopathy is that you're letting the fever do its job, you're letting the immune system do its job, you're not inhibiting it or suppressing it like paracetamol or Calpol will do. So that's the thing with medication and homeopathy. I think sometimes, like, I've had kids come in and you can smell them from the waiting rooms there. And like, that child needs an antibiotic and needs it now. So I'm not against antibiotics. Sometimes they're fantastic. They have saved humanity, I think, in the last 100 years, but they're misused. So what happens when you overuse medication, or for example, if you're using Calpol, is it's blocking the natural function. And the body's like, well, hold on, I'm trying to do my job here. That's why the fever comes back. That's why the pain gets worse, because it's trying to get the white blood cells there. So homeopathy lets our body naturally do that, but will make you feel more comfortable through it.
Yeah, great explanation.
And can you talk then, just to go even deeper into that, can you talk to like, what is homeopathy? Because we haven't even said that. And so if no one knows about that, you know, because I've had people go, Homeopathy, but that's that thing with the placebo thingy.
Yeah. Well, everything, 30% of all treatment is placebo in everything. So that's a whole discussion about the research, which is fascinating. So homeopathy, I think it's over 250 years old. It might be 300. I'm really bad at the history. It was a doctor in Germany, and there was already the theory that you can cure with opposites or you can cure with likes. So cure opposites means if somebody has a pain, you give something that will block the pain. So it's opposites. Cure with likes. If somebody has a pain, you give something that would make that pain, and then it removes the symptoms. So that's the cure, opposites and likes. So
nettle as an antihistamine is a great example. That's one of my favorite ones.
Fantastic. Belladonna for fever. So belladonna is a herb that would actually create a high fever. So you give it for somebody in a fever. And that's actually the B in the ABC in this method. Okay. So there was a Dr. Hahnemann in Germany. He was aware of this. He was translating medical books, and he saw that at the time malaria was horrific in Europe. And he saw that cinchona bark actually cures malaria because the quinone.
Quinine, yeah.
Thank you very much. I'm really bad at pronouncing words. So he decided to take it, and he actually developed the symptoms of malaria. And he knew that philosophy, like, hold on, there's actually something in this. So he was in his circle of peers. He's like, try this. And they start to get the symptoms of malaria. So then he started to develop this methodology of homeopathy, finding medications in the day, like arsenic was a medication in the day. And he started to notice the symptoms of arsenic poisoning and applying that to people who had those symptoms, and they would get better. Now, the controversy with homeopathy is that the remedies, I should actually bring the remedies here, they're so diluted that in certain cases, certain strengths of remedies, there's nothing physically, there's no particles in the remedies. And that's the controversy of homeopathy, because he noticed, for example, arsenic poisoning, people were getting better over their primary symptoms, which is usually a digestive problem, for example, like food poisoning or something like that, or dysentery. But they were dying of arsenic poisoning. So you're like, oh, okay, that's not great.
That's not the best thing.
Oops. So he started to dilute it down, and he noticed that the effect was far more efficient. And so you weren't getting the secondary effects. They're now called ultra dilutions, and that's what the research is showing, that ultra dilutions, even in a medical setting, have an effect. So then he developed, and so he starts, I haven't got the book here, but there's the repertoire, and there is the Materia Medica, and there's the Organon. They're the three main books of homeopathy. The Organon he wrote is the whole philosophy, understanding this healing energy in the body called the vital force. I think it's called chi in different, and in Ayurveda it's called Ama, is it? But anyway, everyone has different names.
Ama is the illness. What's it called? Agni. It's digestive fire. Prana. Yeah.
Prana. Thank you. Yeah. So he described this, how it works, what disease actually comes from, how to heal it, how to apply homeopathy, the remedies, the remedy reaction. That's the Organon. So then we have the Materia Medica, which is all the proved remedies. So remedy proving is when, for example, he took cinchona and he developed the symptoms. So we homeopaths would have a group called a proving, and they would all take a substance, and we would note down the remedy or symptoms from this proving and then apply it in practice. So there's about 3,000 different remedies. And then we have the repertoire, which is all the symptoms that the remedies produce. And it's like an encyclopedia. So that's where actually when you were saying to apply homeopathy in a quick setting, and you have to get the repertoire. You have to know exactly what symptoms you're looking up. You need to look at the remedy. You need to cross-reference all the different symptoms, and then you find your remedy. So they're the three books in homeopathy. So then homeopathy developed, it became extremely popular all the way through Europe. It's still very popular in France and Germany. Over in America before, you look at all the old films, like in Little Women, they're all using homeopathy. Do you remember when Beth gets scarlet fever? They're using homeopathy in that film. Yeah, you'll see it now. So you see homeopathy. So until the turn of the last century, homeopathy was one of the biggest medicines in America. And then there was the dawn of the antibiotics and the medications. So
my biggest argument for homeopathy, for a lot of kind of like treatments where there's an energetic approach, is how well they're applied in animals.
Yeah, exactly.
And it's always the thing, you're like, listen, you can't deny it. You go to top horse people, they're using homeopathy. I promise you. You go to top sports people, any top sports people actually, and they're using arnica, I guarantee you. I'll be like 1,000%. They might not even understand. In fact, most of them would totally poo-poo the idea of homeopathy.
Don't care.
But they're still rubbing arnica on their, like, I don't know.
And the thing is, that's a great thing, is the reports I've gotten from colleagues who they know how I work, so they work with me, but they're on the fence with homeopathy. They're like, well, it's dangerous. What if the person doesn't know the symptoms, or they're letting a symptom run wild and all that? It's all that's why the red flag symptoms. I educate parents on this, knowing that is both homeopathy. There's no side effects. The worst thing that happens is it doesn't work. It's completely safe because there's sometimes physically nothing in the remedies. So it's very safe, even for kids, for animals, for everyone to use. when it's applied correctly.
Yeah, it's a phenomenal thing, because I remember we had a dog who something happened to her, I can't remember, and she got given an antibiotic and then she got thrush. And it was horrendous, like disgusting having a dog with thrush, because there's no knickers, so it's gross. And it's really, and the smell is phenomenal. And we took her back to the vet, because it was like our puppy and we didn't really know, and I wasn't applying logic. I was just like, what do I do? And they were like, we'll give you some more antibiotics. And I was like, no, hang on, no, because you just gave the antibiotics and that gave the thrush. So I was like, no, okay, what am I going to do? So I went to a homeopathic vet, and he gave a remedy. I think it was pulsatilla, I'm not sure. And instantaneous, within half an hour, the green dripping grossness had stopped. And I mean, she didn't know I was giving her anything. It was so easy to give her. And from then on, any time that I gave her a remedy for anything, it worked straight away. And that was really interesting, because my partner was convinced then. He was like, homeopathy. But when he saw it in her, I mean, it was like immediate.
I love when I hear that. I have a few patients who husbands then come to see me, and they're either in the medical field or research, and it's always the same sentence, like, I don't know how it works, but I know it works. And one actually was, they use the ABC method, and he's quite well known in clinical research and in the medical field. And he goes, oh my God, you need to do a trial about this. You need data. People need to know about this. So I was like, oh my God, maybe one day, but I just treat patients. I'm not a researcher, but that's really, to be honest with you, I was just happy like doing the ABC and educating my patients. It's when I heard feedback from that, or the other word from mums is, this is magic. Like, it has stopped the antibiotics. That's when I was like, you know what? I might they had friends that they wanted to learn the method. So I did Zoom conferences. I just don't have time to do them more and more. And that's why I developed the method and I filmed it, so anybody can actually learn this method around the world.
And this is something we talked about a lot, particularly in the last few months, as we've been filming the, excuse me.
I say filming.
Filming. There you go, very Irish, into the West. But as we've been filming the kind of Pregnancy, Birth and Beyond series, we've been talking a lot about this idea that women are supposed to somehow come to motherhood with zero books to guide them, and just total self-confidence that what they do is the right thing. And, you know, there's very little wit and wisdom kind of available to them, and there's no oral tradition really there, because usually grandmothers aren't hanging around the house, and they're not, and maybe they haven't been taught. We've kind of got this cleaved off kind of generation of mothers. They're like kind of at sea and overly reliant, let's say, on the medical system. So this idea that you have a system that like gives the mother tools, totally empowers them, lets them know you're not going to be doing anything that's like fringe or unsafe. And if you have a partner who's not into what you're doing, listen, these are the red flag symptoms. We're not going to go past this line. Everybody can be cozy with it. I think that's the amazing part of this, really.
And it teaches mums, because like you just said that, some mums would say to me, and it's mostly, I see mostly mums, there have been the dads as well who then apply, they know the ABC method, they can apply it as well. It's mums who initially bring the kids to me. And they, I've lost my trail of thought, was about to say, it was so profound, but it's completely gone out of my head.
Was this something to do with the empowerment?
Yes. So they didn't know the symptoms. They were like, what's this? Is this what it has? And they just want support. I'm like, no, you're doing a good job. This is when you have this knowledge. And actually from the group, I then have the private community group. So I'm going to do lives there. It's just like, no, you're doing the right thing. Don't worry about that. Yeah, you need an antibiotic now, but don't worry, you'll figure out why. And it doesn't come natural. It's a bit like breastfeeding. I know you did a talk of breastfeeding. What's it? Myth that breastfeeding just comes naturally to you. You have to learn it. And that's the understanding. And with mums are usually the primary healthcare provider in the house. They're the ones that are like treating the fever, staying up with the kids, usually in a majority of the time. So they think, well, I have to have a whole medical degree to feel confident here. So I just want to you're not a doctor, but at the same time, you know your child, you know your child's symptoms, you know when something's off. And I'm giving you the tool to be able to let the body naturally heal itself.
Amazing.
It takes all the panic out of it, because it's even if you're someone who's really calm and who knows this stuff, the moment that your child gets sick, it's very hard to stay in that calm place. You're like, oh God, what if it's something really terrible? What if, you're looking at this precious little person, like, however I manage this, it's on me, And so it's really easy to just spiral off into something crazy. And it's really nice to have someone holding your hand, or to have some kind of simple structure that you go back and you're like, no, I know this. This is my reference point, and it's easy and it's not overcomplicated.
Yeah. And I've been in that position when I've had patients contact me at 6 a.m. I'm like, oh my God, I think this is meningitis. I'm like, this is, my patients now know, and I go, this is fine. This is totally fine. Just need you to go to the hospital now. And it's always been grand, but you always have the medical community to fall back on. To me, it's there for a reason. It's like I said, it's not the medication, it's the misuse that is the problem. So we just need to bridge that.
Yeah, treating as the first port of call is the issue, isn't it? Yeah.
And so if women listening are like, okay, this is good, I'm interested, I want to know the things.
Okay.
How do they book an appointment with you? How do they learn the ABC
Okay,
method?
so I've just done this today. So the course is actually going to be up on Teachable. So I've just uploaded that. You get the nuts and bolts. So it's a 7-module, 1-hour course. You've done all the methodology, the understanding the immune system, the red flag symptoms, how to apply it, remedy reaction, toolkits, essential remedies to have at the home. And then after that, you get the transcribed version if you prefer to read, and then you get into the ABC community group. Now that gives you the basis. Now some people actually prefer to then book in with me as well afterwards, because we all do similar cues. Like when I was teaching this live, I was getting some groups that had sore throats, some groups that had cough. So they wanted to get a more specific remedy kit. So that is an option, but you will get all that from the group as well, to be honest with you. You can learn this in 1 hour and apply it the next day, straight away.
Amazing.
That is amazing.
That's
It feels like one of those like infomercials. Learn homeopathy in an hour.
They're doing money back. Like I've been ill for 30 days. What's happened? That's the point I want to, because I say this in the course, is that if you have used, I have some people like, well, I've used antibiotics, so like it's done for me now. I'm like, no, we can still do the ABC method. However, when you've been doing antibiotics, that mucus stage, the body trying to clean itself out, that stage will be prolonged. So as long as you know you're getting the right the reaction, which is the fluid, thin, clear, sometimes white mucus, and it's all coming out, you're doing fine. But if you've had multiple courses of antibiotics, you're doing this for the first time, just that bit is a bit longer. That's it.
And so we're talking about antibiotics just very briefly. I know we need to round up, but antibiotics and homeopathy together, kind of a no-no. One, like antibiotics just going to kill the homeopathic kind of remedy.
There's no point just with the antibiotics. Now, like I said, there's the recovery stage. So there's a remedy for the recovery stage. You would do that after the antibiotic, and it prevents that, because antibiotics actually, it's known to treat bacterial infections. But the reason why sometimes people get relief, because they now know it has an anti-inflammatory function as well. So you think your infection's gone and it comes back 3 weeks later. That's usually in terms like strep throat. Yeah. So you kind of give the recovery remedy as well to try and prevent that. But I usually warn patients to say, listen, in about 3 weeks, it's going to hit again. I'm like, no. And then like, oh God. And so that's when we start with the remedies.
Okay, great.
Brilliant.
Thank you so much.
People find you where? On Instagram?
So mostly on Instagram. I do my rambles there. I have my website. I have a Facebook, but I'm very rarely on it because I'm not very technologically minded. So you'll get me on Instagram.
Okay.
And all my details are in there.
And it's at what?
Julia Homeopath.
At Julia Homeopath.
That's
very
great.
Simple. Good.
Perfect. Nicely done.
We'll
That's something we can
I'm trying to get juliahomeopath.com, but I think somebody else has it. I'm raging.
My
website.
I wonder maybe how to work around that. I wonder. Julia's ABC.
Yeah.
Oh yeah.
That's good.
Maybe good.
Not a bad one.
Anyway.
Okay, Julia, thank you so much. That was brilliant.
Thank you so much.
And it was nice to laugh.
Yeah, absolutely. Nice to have a laugh with you as well. It's lovely when also, medicine or the practice of some form of medicine doesn't have to be just taught in a very serious and somber way. And it's great. You've great charisma and personality, and you're so clear. It's great to have that. I'm really, really glad we had you on. So thank you so much for coming.
Thanks so much for having me. It's been brilliant talking to you. Brilliant.
Nice one. Same. I guess it just is left for us to thank our sponsors. So Newsdesk Nutrition, our fantastic nutrition partners, who produce the best of all vegan, plant-based and vegan, of course, organic whole food proteins. We both use them. We're giddy about them. We recommend them all the time. It saves people a fortune in time and money, actually, because it piles a whole load of nutrients into single things. So they're good green vitality shake, they're kids good stuff. As kids are going back to school, it's a really, really important time to think about their zinc and their selenium and iodine for the thyroid, all these sorts of important things. And so they'll get onto those guys. Also, then we have Clear Light Saunas, who are fantastic. Clear Light infrared sauna partners. I know not everybody gets a sauna partner, do they, Julia?
I love one of them.
Deadly. Well, there you go. Okay, come and talk to us.
Absolutely.
Totally. We'll talk you through the whole thing. I have one in my back garden, so we can show you how it works and that sort of stuff. But yeah, so thanks to them as well. And finally, but thank you very much to you, and thanks for coming along and giving us all of that wisdom and being so open and free to share it. Yeah, this is you. This is you. Thanks to you, and also thanks to the guys watching as well. Why not that? Yay!
Thank you very much, guys, and we will see you again next time. Bye.
Bye.